With us now is Dr. Ronit Adler, and I am so happy to have her on the show. Life is such a weird serendipity, if you will, of things that happen. And our daughters knew each other when they were little girls. And so when she came to set, we just looked at each other and I said, Ronit, she's like, Donna, and is like, bada-bum. But we are here today to talk about her wonderful gift and the things that she does. Welcome to the show. How are you?
Thank you so much. It's great to see you.
What a fun treat.
So fun.
So I've been researching you and learning about you, and then we just put two and two together. And today we're going to be talking about aesthetics. So tell us about your specialty.
Okay, so my specialty came about in a very evolutionary method. First, I was an anesthesiologist, and then I studied pain management. And what pain management allowed me to do was to really put needles into people in all different locations for the sake of taking their pain away. That gave me a confidence of needle placement. I think a lot of doctors that do aesthetics don't have that level of comfort. So with that and the artistry of my family, my entire family are dancers. They dance in the ballet, and artists, painters, and such. So I do have that artistic flair, and that combined with the comfort and the confidence of needle placement is what you need to do with aesthetics. So that evolved. First I started with the Botox. We were doing it for the headache therapy, and then we noticed that it also took away wrinkles. So that was great. Then I evolved into something called mesotherapy, where you take all holistic products and you inject it locally under the skin, very small little needles there, pain-free. And what that did was it tightened the skin, and it also melted fat. So that was amazing. It was originally created for pain management. So once again, I got pulled into it. Then the newest evolution is really PRP and stem cell therapy, which initially was presented for athletes. What PRP is taking whole blood, spinning it down, getting a very purified buffy, what's called the buffy coat, which has the platelets in it. Platelets have growth factor, and what that does is it regenerates, and it's almost like the youth serum. So by using that under the skin or doing a facial with it, completely regenerates the skin. It causes all your collagen and fibroblasts to come and lay down exactly where they need to be.
Now, it's so fascinating. Like I said, it's interesting to see how you've evolved over all of these years, because I knew you when you did the pain management. So I understand the growth even in the transformation in the company and the things that you're doing, and technology is so fascinating, and you're such an avid learner, right?
Yes.
So to me, it seems to me like you research something, you find out how to do it, and then you apply it. What has the success story, what have some of the success stories been? Without naming names, what transformations have you seen in people?
Well, I mean, there's nothing more rewarding. Just as pain management immediately alleviates the pain, and then it just remains a question of how long is that going to last. Same thing with the cosmetic portion. You're injecting something that is from your own body.
Okay.
So you're not taking anything exogenous. And you're purifying it in its purest form and putting it back into the patient. And they are immediately so happy, because it's, instead of using facial fillers, which is a foreign substance, you're using the patient's own methods for healing and looking as best they can.
And do you consult with your patients? You decide which therapy is going to be, which modality is going to be best for them?
Well,
like based upon their skin type or their age? How does that work? How do you know what to do?
Oh, that's a great question.
Okay.
Because actually, you have to work together with the patient. So they have a certain objective, and then you look at them, and you have to be artistic in how you're looking at the face and understand that, no, in this particular instance, we're going to have to lift.
Okay.
In this particular instance, we're going to have to add volume.
Okay.
So things are different. As you get older, everything starts to come down. So the method that you want to employ is always a lift and a volume.
Okay, lift and plump.
Yes.
Right? Smile. Ta-da!
Whether it's your butt,
right.
your breast, or your face.
I was going to say, you do high knees, right?
Yes, I
okay.
do.
So you do augmentation of that area. So if you lost your lift there, you could plump it up a little bit.
Exactly.
Okay.
And that's something really that is very, very cutting edge. And I think I'm probably one of the only people in Long Island presently doing that. It's kind of something that I evolved from a different procedure. And what that is, again, is taking your platelets with the growth factor and all the regenerative processes, injecting them into your buttock, with sometimes using a facial filler, which is completely off-label use. It's not FDA approved, but it works great, and people are extremely satisfied, and it's immediate.
Wonderful.
And then it improves over time.
And what is Nova? I know that you mentioned Nova. I want
Okay.
to talk about that before you.
Thank you.
Yeah.
Thank you for mentioning
Yes.
it. I'm so excited about everything I do.
I know,
but-
no, as you should be. I mean, it's fun.
The Nova thread is a brand new technique where you're actually taking a dissolvable suture that has little barbs on it, and this is the first thing that actually will cause a lift rather than just the volume. So where you're using facial fillers to fill lines, this is more of a lifter. So if you have a jowl line, it will actually, just by placing the thread, which is dissolvable, it'll lift the skin up. Now, you will see immediate results, but it really gets better with time because the body will then create its own fibroblasts, collagen, because it's seen as an irritant. The thread is seen
and the
as,
body is going to react to that.
correct. And,
Oh.
and by doing that, you'll get an amazing lift without a facelift.
Wonderful.
No incisions.
And if somebody hasn't done this before, you offer consultation? Somebody could come and talk to you
Yes.
about it first? Because sometimes people want to do it, but they just they don't want to just all of a sudden do it.
I offer two different things. I
Okay.
offer a free consultation in the office where we
Okay.
can discuss more by looking. And I also offer a phone consultation. So if somebody calls and they're interested in something, but they're kind of hesitant to move forward, I'm more than happy. We set up a time and an appointment, so to speak, a phone appointment, where I can speak to them and tell them exactly what I think the process will be.
Fabulous.
Yes.
Thank you so much. And I can't wait to reconnect our daughters. So
Thank you.
so thank you very much.
It was amazing.
Thank you so much for joining us on Live It Up, Dr. Ronit Adler. Stay tuned for more.